Depression is a major, common, and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it's also treatable. Depression causes feelings of sadness or a loss in interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work, at home. Depression symptoms can vary from mild to severe and can include feeling sad or having depressive moods, loss of interest or pleasure in activities once enjoyed, change in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity, e.g., inability to sit still, pacing and hand-wringing, or slowed movements of speech. Feeling worthless or guilty, difficulty thinking, concentrating or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for a diagnosis of depression. Also, medical conditions such as thyroid problems, a brain tumor, or vitamin F deficiency can mimic symptoms of depression, so it is important to rule out general medical causes. Depression affects an estimated of 15 adults, 6.7 in any given year, and 1 in 6 people, 16.6%, which experience depression at some time in their life. Depression can occur at any time, but on average, first appears during the late teens to mild 20s. Women are more likely than men to experience depression. Some studies show that on 1/3 of women will experience major depressive episodes in their lifetime. There is a high degree of heritability, approximately 40%, when first-degree relatives, parents, children, stroke siblings have depression. The death of a loved one, loss of a job, or ending of a relationship are difficult experiences for a person to endure. It is normal for feeling of sadness or grief to develop in response to such situations. Those experiences loss often might describe themselves as being depressed, but being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in waves, often intermixed with positive memories of deceased. In major depression, mood or interest are decreased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feeling of worthlessness and self-loathing are common. In grief, thoughts of death may surface when thinking of fantasizing about joining the deceased loved one. In major depression, thoughts are focused on ending one's life due to feeling of worthlessness and undeserving of living, or being unable to cope with the pain of depression. Grief and depression can coexist for some people. The death of a loved one, losing a job, or being a victim of physical assault or a major disaster can lead to depression. When grief and depression co-occur, the grief is more severe and lasts longer than grief without depression. Distinguishing between grief and depression is important and can assist people in getting the help, support, or treatment they need. Depression can affect anyone, even a person who appears to live in a relatively ideal circumstances. Several factors can play a role in depression. Biochemistry, differences in certain chemicals in your brain may contribute to symptoms of depression. Genetics, depression can run in families. For example, if one identical twin has depression, the other has 70% chance of having the illness sometime in his life. Personality, people with low self-esteem who are easily overwhelmed by stress or who are generally pessimistic appear to be more likely to experience depression. Environmental factors, continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Depression is amongst the most treatable mental disorders. Between 80% to 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from the symptoms. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and a physical examination. In some cases, a blood test might be done to make sure the depression is not due to medical condition like thyroid problem or vitamin deficiency. Reversing the medical reversing the medical cause will alle- alleviate the depression like symptoms. The evaluation will identify specific